Welcome back, rheumatology fans. We're going to talk about gout. Do like talking about gout a little bit, but also cardiovascular disease cardiovascular disease risk. And the reason for that is a couple of reasons. People with gout have an elevated cardiovascular disease risk. It's usually calculated over 5 years. So the risk of having a cardiovascular event, heart attack, stroke, something like that, is elevated over the next 5 years in people with gout. So there's a couple of reasons for this. One, gout is an inflammatory condition. Increased inflammation within the body increases cardiovascular disease risk. But also people who get gout have some shared risk factors with people who have an elevated cardiovascular disease risk. So the combination of that means that we need to be careful with people who have developed gout to make sure that their cardiovascular disease risk is reduced, or at least as minimised as possible. Don't know many people that want to have a heart attack or a stroke, so it's always a good idea to try and minimise those. So there was a very big study. Now, apologise for me reading a couple of bits of this, because obviously some of the numbers are to be really specific on. So over 5 years, there was a study, and they what they did was they took people who had developed gout. They tested their serum urate level, so the amount of uric acid in the blood, essentially, and then when they were treating with urate lowering therapies, something like allopurinol, they were looking at the people that achieved a urate level of under 6 in the blood versus people who didn't achieve that. They basically, what they found was, in those people where they call it treat to target, so to target having a urate level lower than 6, they found that cardiovascular disease risk was reduced in those people compared to those who didn't achieve under that urate level of 6. So it's measured in milligrams per deciliter. If you're interested in that, that's what the 6 is. Under 6 milligrams per deciliter is the score they were going for. So just a couple of extra numbers here. It was a really big study. They had over 100,000 patients, and they had some of them in this treat to target arm where they aimed to get them under 6, and the others were just treated sort of however a clinician deemed appropriate. And as I mentioned a little bit earlier, those people in the treat to target groups, they got them below the 6 milligrams per deciliter in the bloodstream. They had a reduced cardiovascular disease risk over 5 years, but they also had fewer gout flares. Another bonus that sort of proves the treatment is working really well. They did subset them down a little bit. Those people with higher cardiovascular disease risk at the outset got a better effect. So if they had other cardiovascular disease risks, say they had very high blood pressure or a family history of cardiovascular disease events, they got a better benefit or more risk reduction than those people who didn't. Now, what the important component of this is that we need to be making sure when someone is diagnosed with gout, we need to take into consideration their other cardiovascular disease risk factors, and we need to make provision for that. So that comes in two sort of sections in my mind. So we ideally are looking at monitoring this uric acid level in the blood and trying to get it below 6. So there'll be a combination of lifestyle factors and the urate lowering therapies like allopurinol. So we want to avoid things like alcohol as much as possible, reduce abdominal fat, smoking, so not smoking, those kind of things are going to reduce that uric acid level down. So we want to be doing that in all of our gout patients. So if you've got a patient who you suspect having gout or has been diagnosed with gout and you're seeing for something else, just really pay attention to those cardiovascular disease risk factors and make sure we're intervening appropriately, or at least it's been flagged to somebody whose job it is to intervene appropriately. So that's sort of my advice here. Really interesting study. I will put a link if you're watching or listening. There'll be a link in the description to the actual study. if you are so interested in going to have a look at that. But please do consider that in our gout patients, and we will do a much better job of looking after people's health and fitness and all that kind of thing. So yeah, I will see you next time. Make sure you're liking, subscribing on whatever channel you are hearing me, seeing me, reading. Then that really does help. Obviously, spread the information. So tell all your colleagues, etc. And yeah, I'll see you next time on Rheumatology Physio.